Well, when most people think of UNICEF, they think of an organisation that helps children around the rest of the world. But the organisation is now being used by the Australian government to help with our vaccine rollout right here in Australia, specifically to reach groups that won't perhaps be keen to take up the vaccine because of vaccine hesitancy. Earlier I spoke with UNICEF Australia President Anne Sherry.
So UNICEF's role in vaccine delivery globally, I guess, is probably better understood than it is locally. But we've got vaccine hesitancy in Australia. So our partnership with Health is to use our network of ambassadors who are often younger, on social media, speak to a different audience, speak to a more diverse audience as well. We've got, for example, ambassadors who have been refugees from Africa.
Right.
Those communities are hard to get to using a traditional TV or newspaper.
So you know, the Dr Nick Coatsworth we see, they see him, none of that really gets through. They might not trust government as well.
Well, and I think people, even during the pandemic, have had experiences that have made them a bit nervous about government and what can be done to you if you don't toe the line. You know,
testing, borders.
Yeah, a lot of that is confusing, I think, to lots of the communities that we need to be vaccinated because we won't get herd immunity in Australia. We won't be properly protected if we have big communities who don't get vaccinated. So our role with Health is going to be to reach out to them in different ways, to speak to them as we would speak to any of our community of interest at UNICEF about the value of vaccine. And of course, we're a familiar brand to them.
Right.
Many of them as children in other parts of the world would have seen us.
So is it a lot of migrant groups in particular? Where will your focus be?
That's one big target audience. But we speak to children. And so having kids talk in their own families about what's good about vaccination is often powerful as well.
Get the kids to spread the word.
Yeah. So, you know, we ran a campaign with the Wiggles, who are ambassadors, on washing your hands. And we know that adults say, well, our kids talk to us a lot about hand washing because they saw it on the Wiggles, you know. So there are many ways, I think.
The house and
many ways of getting messages out.
And you just mentioned their vaccine hesitancy. So what do we know so far about the lived experience? I know we've got lots of polling in Australia, but we don't really know how this vaccine will compare to others. What so far is the lived experience of the COVID vaccine versus other vaccines in terms of hesitancy?
It's probably a bit early to tell in Australia. We've got the research that says, you know, 60+% are happy to go with the vaccine. There's probably a group in the middle that are still waiting to see. You know, does it have any impact? What is it? And there's around, we estimate, 30% who are very hesitant.
But a potentially big number. How does that play out compared to other countries where we have had much more of a rollout?
It varies country by country. In some parts of the Pacific, for example, we know there's probably 50% hesitancy. And so it's going to be even more important that we get good education, we work with people on the ground in those communities, rather than telling people they've got to have a vaccine. That doesn't work.
So you mentioned the Pacific, a lot of focus in our region on PNG. Also concerned though with Indonesia and COVID at the moment. What are the real hotspots do you think that might need more assistance?
We were talking today about Timor-Leste. It looks like the numbers are rising there. Indonesia as well. Obviously Papua New Guinea, which is topical at the moment. And, you know, as it has been here, there's a lot of movement of people around those specific communities. Even without air traffic, people move. And so that's the reason we really need to get into the communities and try and get the vaccine delivered.
And so you mentioned reason. Obviously wanting to help people is a reason in of itself. There's also it being on our doorstep and mutation. Also, though, soft diplomacy. If we don't help them, China might. It's all a competition out there in the region at the moment.
Yeah, it appears to be so. And we've got very long relationships. So we're in a good position to work with governments in those communities and stay with it over not just the vaccine rollout, but of course we expect, and we heard this morning from some of the vaccine experts and some of the health experts, this is not going to be the last pandemic we see in the next 10 years. And so building those relationships, I think, is going to be really, really important for Pacific diplomacy. You can't say, we want to be there to help you and then not be there at the critical moment.
And so this is possibly a good thing to leverage with the US. We're desperately trying to get doses out of Europe, but AstraZeneca doses in the US could be sitting there idle. We could say, hey, if you really want to have an impact on this relationship, send them this way.
And I think if we can't get AstraZeneca out of Europe, that's where we need to go. We need to go to the US and leverage that relationship, because they're also interested in the Pacific as a diplomatic.
And so the Australian government could push the US government and say, release these doses.
Well, ask them. Yeah, let's go to them and ask them. We've got a good relationship with them. Let's say, can you release them to us?
And Sherry, great to have your time today. Thank you.
Thank you.